LeBron James was out for the first 4 weeks of the NBA season with a condition called sciatica. I'm going to educate you on what sciatica is and how it affected his play. Let's talk anatomy. The sciatic nerve is the largest nerve in the body, and it comes off of the lower back in the lumbar region and the sacral region, which is your tailbone, at your L4 to your S3. From the lower back, it runs through the glute, down the back of the leg in the hamstring region, and then behind the knee, it actually splits off into two separate nerves, your common peroneal on the outside of the leg and your tibial nerve, which runs through your calf. And sciatica itself is a broad term as a condition. Essentially, it just means irritation anywhere along that sciatic nerve. We can see this from a herniated disc in the low back, which means that that disc is slightly displaced and or the jelly inside of the disc is starting to come out. It can be caused from spinal stenosis, which is essentially deterioration of the vertebrae in your low back, or it could be from nerve impingement or compression anywhere along that neural tract where that nerve runs. Symptom-wise, we're looking at pain, burning, numbness, and tingling, and these can be localized or traveling throughout that whole sciatic chain, low back, glute, down the leg, and sometimes in severe cases, we even see substantial muscle weakness, which can really affect an individual's function. How does this affect basketball? Well, if an individual is experiencing this, they can have trouble running, jumping, making quick lateral movements. In addition, if it's very severe, they can even have trouble walking. Now, with LeBron James entering his 23rd season and about to turn 41 years old, I can completely understand wanting to take 4 weeks off and him even explaining that this was a severe case. Traditionally, sciatica is very hard to treat the longer you let it go, and if you could attack it from an early stage, it's a lot more likely that the outcome is going to be positive. There's a variety of treatments that are used for sciatica, and it's very important to find the underlying cause because no two cases are similar. Now, for LeBron James himself, I read online that he received an anti inflammatory injection into his low back, which, if I had to assume, was probably a steroid, coupled by physical therapy, yoga, and predominantly stretching. Now, LeBron does have access to some of the best physical therapists, trainers, chiropractors, and doctors in the nation, so I'm not surprised that he's making a return in his 23rd season. And he did very well last night with 11 points and 12 assists in his first game of this 2025 NBA season. I hope you learned something. If you guys could, let me know what you want to see in terms of sports injuries or any related topic in healthcare. Follow for more PT without the boring lecture.